In the next part of our interview with Brad Williams, we sat down and talked about what it's like from a patient's perspective. If you're suffering without your medications right now and you're going to get on patient assistance programs, and whether you're getting help or not, we talked to him about what it's like for the patient and what are the serious consequences that can happen if you mismanage your programs. And what can you do to ensure that you get an ongoing supply of your prescription medications? And Brad explained very well. Here's our next segment. Now you say, or worse.
Yes.
You say someone in the hospital or worse. Does that mean they could die?
Absolutely. We have people that are on Epivir for HIV. We have people on a number of different oncology drugs for their cancers. If you don't take these drugs, yes, you can die. If you don't take your blood pressure medications, you can pass away. This is unfortunate, and it's a terrible problem that many of these people are in the positions of. Remember, if they do it themselves, and many people can and do, they're still in this position. Luckily, we're here for the many patients that can't do it themselves, and we make sure they stay on these programs to get these medications. They can pass away. They can go to the hospital. They could wind up, I don't like to say it like this, they could wind up the ER. They could wind up in the morgue. That's exactly true. They could die.
And so the work that you do in the advocacy department of Select Care Benefits Network, would you say it saves people's lives?
Absolutely. We don't just save people's lives. We help people stay on their medications and live a full life. Many of these people who are elderly, especially on blood pressure medications, if they quit taking their medications, their life might be cut short, when in reality they're just trying to enjoy their golden years. They put in a full life of work in a good country, and at this point now all they want to do is relax and live out their years. Other people taking cancer medications, they need these drugs, otherwise they might not go on. As a result, yes, we save people's lives, and more than that, not just in saving their lives, we help bring a better quality of life to thousands of our patients across the country. And we're not talking just in one region. We're talking from Lome, Alaska to a few blocks from where we're located here. We're talking from Honolulu, Hawaii to New York, New York.
Now, you talked about oncology patients, people with cancer. We take care of a lot of those?
Absolutely. We take care of hundreds of people.
Tell me the situation of your average oncology patient who calls us asking for help.
The average oncology patient is in a very difficult position. One, to have called us, they must be on a fixed income, and more to the point, that because of their cancer, whatever it can be, from pancreatic cancer to a brain tumor, these are very debilitating diseases and illnesses to have. One, they're expensive to manage. Two, they do kill people quite a lot in this country, quite a lot. Now the issue with most of them is they can't get medications through prescription coverage because they can't get coverage. A lot of them these are pre-existing conditions. They can't get assistance even if they have a fair amount of money. As a result, you're looking at $4,000 a month to pay out of pocket, and a lot of these people are on $1,100 a month in a household. They can hardly make their rent, their bills. A lot of them can't even do that, and now all of a sudden they're sick and ill with a terrible form of cancer, and they have no way of fighting it, no way of treating it, and as a result, they can come to us, and we can help get them on these programs to take care of them, literally for almost $20 a month in membership to assist them with any individual program. And as a result, if you take into account someone on $4,000 worth of medications, just one, paying us only $20 a month just to manage their paperwork, keep them enrolled in the program, make sure their medication arrives, not only is it massive savings, but do we save lives? Absolutely. And that's another way.
$4,000 a month. One medication?
Absolutely. Drugs in this country are reaching an astronomical level. I mean, let's look at the facts. How many Americans go to the pharmacy with or without insurance just to get a medication they're on? From ADD to cancer, literally everything. And all these brand name drugs, granted there are generics out there, but even some of the generics are over $100 a month. And most of the brand names, the average cost of a brand name nowadays, if you're going to CVS or even Walmart, if it's not on their generic list for $4, can reach upwards over $100 a piece. Now imagine being on 5 medications, that's $500 a month for 5 just average medications, from blood pressure to other minor situations. But when you deal with cancer, no, you're dealing with a very specific situation and a very expensive medication. much like the patients that we have, the dozens of patients that have HIV. Those are thousands of dollars too, and they have no access to these. Doctors don't stock samples of these medications. They're too expensive, and the pharmaceutical companies don't give them away. And if they do, it's in a very small quantity. So it's not like one of these patients that is uninsured, that can't afford these meds, can go to the doctor and get an ongoing supply of them forever, as they would need to. As a result, coming to us, we not only manage their account for a modest fee in membership dues, we make sure they get what they need to survive.
So, an oncology patient, you said $4,000 a month, obviously the highest end drug. What are some of the cheaper drugs that oncology patients need to take? And second part of that question is, aren't they getting this through the government or any other programs? Or why are these, or is it covered through their chemotherapy or other treatments? Why are they getting on an outpatient basis where they have to pick it up at their pharmacy and they can't afford it or whatever else? What's the range of cost of drugs, and why are they necessarily given on an outpatient basis?
Well, there's a couple questions here. The range of drugs, there can be a few oncology drugs perhaps that cost only a few $100s a month. It just very much depends where you go and what you're on. It really just depends what drug you take. However, if you wind up in this situation, and there's thousands of Americans that are, they're in a range between making enough money to support themselves and get perhaps insurance through a company they work with, or getting private coverage, even if they're not blocked by a pre-existing condition such as their cancer, or they fall in an income range that you can be assisted by the government. Now, the patients we assist are trapped in between. They're almost in limbo. It's a very terrible problem. They're not able to fix all of their problems themselves, but they're not at a level where the government's willing to take care of them. As a result, they're trapped. They have nowhere to go. Medicaid can't help them. No other group can assist them, and they don't have insurance. And because they don't have insurance, they certainly don't have the money to buy them themselves. They're trapped, and they have nowhere else to go.
So they call you. They call you. Normally, because they're desperate. The government won't help them. They can't get insurance. They make too much money for the government. They're too sick to get a job and get insurance through that. They have pre-existing conditions. No private insurance company is going to write them a policy. They call you. Why do they call you? And what do you do for them?
Well, they call us because they need help. And most times, you're right, they're absolutely desperate, and for good reason. They can't get covered. They can't get covered by a prescription policy. There's no way. And they wouldn't have the money to do it even if there was someone to cover them. Even if they got a policy, it would be so expensive they couldn't afford that anyway. And more to the point, they still somehow fall in between the guidelines where they still just have a little bit too much money for the government to assist them. They're completely trapped. And as a result, they call us, and many are desperate. And I would understand. They're sick. They're possibly dying if they have cancer, or like many of our HIV patients, they're dying of HIV or sick with it and trying to fight off a very insidious disease. So yes, they are desperate when they call us, and they're looking for someone to help them, to take care of them, to reach out to them and assist them when no one else was willing to do this. And that's exactly what we do. We help get them on these programs. We help keep them on these programs. We help give them hope. We help them make sure they get their medications. It's not just improving quality of life. It's all about extending life in many cases, especially these cases. People with cancer and HIV, this is exactly the point. Or if they've just received a transplant for a kidney or a liver, taking anti-rejection drugs that are thousands upon thousands of dollars as well, they need this help. They can do it on their own, as I've said before, many people can, but many of these people are indeed desperate that need the assistance. And honestly, for the modest fee our membership dues are, they pay little to nothing for how much they save. Not only do they get their meds, they probably have a very large disposable income left with which to live their lives. We're talking about maybe new TV channels. Maybe they don't have to actually eat a lower level or quality of food. They can actually eat something better, and they can live a happier life while they extend their lives. And they know that someone is there as their safety net, taking care of them and making sure they get what they need. That's who we are, and that's what we do. We take care of getting them their medications.